What is up, friends? Happy Saturday. I'm here with the wizard, Dr. Love, Dr. John
That's
Laurent.
my Wi-Fi.
We're going to be recording a podcast here about autophagy, mTOR, how to accelerate ketosis, and your fasting benefits. So if you want to learn about cellular health, if you want to learn about how your body functions at the cellular level, you're going to learn a lot. This is a live recording, so grab a pen and paper, take notes, and also let us know where you're watching from. What do you want to say to them before we start?
Well, I invite you to get a notepad out and join us because my intention is to make the complex simple and to map out some easy strategies for you to make some radical improvements in your health.
That's right. I always learn something from you. So you're going to get a sneak peek access at this interview before it's even out to the public in March. So this is not going to be released till March. So you're blessed right now because Dr. John is one of the best in the game of health. We're going to start the podcast talking about my treatment I got yesterday, and then we're going to dive in. So you ready?
I'm ready.
Dr. John Laurent, welcome back to the Keto Camp podcast.
Ben Azadi, I am so happy to be here with you. You're a wizard in your own right.
No, you're the real wizard. I didn't even mention this to you, but you are only the third guest for my show to be on for the third time, a three-peat. So Dr. Pompa has been on 3 times, Dr. Jeff Matheson, but you're the third person now for a three-peat.
Wow, what a privilege.
Yeah, you're the right person to be here today.
Yeah.
So we did record 2 episodes before. Dr. John was on episode 185, where we talked about melatonin, how that helps with sleep, preventing cancer. We talked about the gut. You can listen to that right now or watch that on YouTube. And then episode 169, which is the first time, we talked about some treatment I did at your clinic, suppositories, the Zen nasal spray, which my followers see me use all the time, every single day. I love that nasal spray. Today's episode is going to be more about autophagy, mTOR, mitophagy, cellular health, how to enhance a fast, some really amazing biohacks that we've never even shared before on the podcast. So I'm excited about that. Before we get into the autophagy stuff, I was at your clinic yesterday because I'll just share a quick backstory. I was obese for most of my life, right until I was 24 years old, and I used to have really bad back pain. I did CrossFit, I used to pull out my back, but I lost the weight, but I was still getting this intermittent lower back pain. So I reached out to you via Voxer, and I'm like, look, I'm dealing with this, I'm seeing a chiropractor, I'm getting adjusted, and you mentioned, hey, come up to my clinic, let's do some treatment. So I showed up yesterday, a little nervous. Every time I show up to your office, I'm nervous, and we did some treatment. So what treatment did we do on my lower back? What did you discover, and then what treatment did we do on my lower back?
Well, first of all, I'd like to say it was an honor that you did reach out to me and respect, my opinion on the whole subject. And I think it turned out to be a really good situation because we found some really interesting things that we'll talk about. But for those of you watching this, I am a chiropractor, and so my background is in chiropractic, but I'm also a naturopath. And so I have a unique perspective when I look at orthopedic conditions. I've always wanted to really understand the core problems that underlie symptom. So anybody that has back pain, their problem isn't the pain. The problem is what's causing the pain. And so as a chiropractor, we're taught to look at structural aspects of the spine, whereas the pelvis might be rotated, one leg might be shorter, a vertebrae might be rotated over the right or the left, and there also may be movement patterns that might not work. So when you do an adjustment on a patient, you're actually improving the mechanical movement of that. And one of the things that I was taught in chiropractic school is that when you find an area that is hypermobile or it's moving too much, to stay away from it. And so your training is to find the areas that are locked up and only adjust those. But that can be quite difficult when you're trying to mobilize an area and there's an area that's damaged and moving too much right next to it. It's difficult to only move that one that's locked up and not actually put some motion into the area that really we don't want to.
Right.
So there was never any tools that were taught to us, and as far as I know, there's literally zero tools that your average chiropractor has access to address the area that is generally causing the pain, which is the damage. So early in my career, I was in a car accident, and I had a severe injury to my lower back, and I thought it was a disc. I went and had an MRI. MRI came back with this big disc bulge, and it was pushing on the nerve on the right. My pain was down the leg, and I was almost certain that it was my disc. In fact, I went to an orthopedic surgeon who was the best neurosurgeon in town at the time, and he said, I'm going to need surgery at some point, and that was indeed my disc causing the problem. Shortly after that, another naturopath friend of mine that was just getting out of osteopathic school was being trained in something called prolotherapy, and I told him my problem, and he said, prolotherapy may actually not only support your disc to heal, but it may actually be that it's not your disc at all, it might be the ligament. He suggested doing prolotherapy, which has lidocaine in it, and dextrose, which is a hypertonic sugar, injected into the area, and ultimately, temporarily, you'll have a relief in your pain, which would be diagnostic that the injected area was causing the pain, and he had no intention of injecting my disc. So he says, I want to inject, it seems like you have a lot of damage to all these ligaments from the injury. We're going to do prolotherapy on it. Your pain should go away for 2 hours if we hit the right spot. And if that's the case, if we do a series of these, and it'll heal your problem at the core of what's really the problem, right? And so I like that idea, and I was just shocked when I stood up from the table after my first treatment. I had zero pain.
Wow.
He did not inject. It was my SI joint, actually, which is one of
Similar
the areas.
to me.
So that started a huge, it was a big aha moment early in my career. And since then, we've been providing regenerative injection treatments at my clinic. And that area of medicine has grown, where the next big breakthrough was where we started to pull blood, and we would centrifuge the blood and take the healing components of the blood and inject those into areas that were damaged, which is essentially what your body wants to do. And so a lot of these connective tissues that get us in trouble and cause the stabilization to fail in any joint in your body, they're very dense. So your body gets these injuries and it can't heal them back because it can't bring in the groceries, take out the garbage. It's like your fingers and your toes, if they get damaged, they don't heal very quickly because they're far away from your heart. But there's also the denseness of the tissue that also affects the circulation. So connective tissue being so dense, cartilage being so dense, those are the structures that get you in trouble. So when you hear the word arthritis, I want people to start thinking more in terms of what actually is arthritis, which is loose ligaments, which destabilizes the joint and allows for cartilage to become nicked up and becomes rough. So you want to start thinking about things that are going to fix that. What's going to strengthen ligaments and tendons, and what's going to create a more friction-free, smooth surface to cartilage. And that's what we're working with now in the clinic, where we're even using bone marrow and different placental stem cell products. So things have gotten much further along in this industry, where we can fix things in 1 or 2 injections, where it took us much, much longer. So that's in a nutshell the kind of the area of medicine that I introduced you to when you called me up, because you were like, hey, my back hurts, I'm going to go to this chiropractor. And I said, that's a great idea. However, from the sounds of it, it sounds like you probably have some connective tissue damage. And so that's what we treated.
Yeah, so I showed up, and by the way, we're recording this podcast, we didn't mention it, at your home. You have a great biohacking home. We'll do some cool things. We'll show some footage on the YouTube interview, but we're here at your home here in Sarasota. Your clinic is not too far away. It's called Advanced Rejuvenation, your clinic. So what you did is, when I showed up to your clinic, first you did some TRT treatment on my lower back. What is that? Why did you start with that?
So tissue regeneration technology, we also call it stem wave. I'm not a big like gadget guy. I mean, I like a lot of gadgets, but when it comes to things that can actually heal the body, I'm a big fan of laser, but the changes and the results with this machine blow laser therapy away. So it's a sound, light, and PEMF all in one. It's a German technology. And the depth of penetration of this machine, where we can treat hips and lower backs, is really exceptional. And so we use that to stimulate stem cells. We use that to improve circulation, We use that on a lot of patients with neuropathy. It's really good for that. Just any area where there's any damage in the body, we can use this device and it can greatly enhance healing in the body. So we combine that with the injections of the platelet-rich plasma. We drew your blood, spun it down.
Before you get into the next step, I want to be fully transparent here. You're pulling my blood, my Raynaud started to flare up, right? So you had to keep releasing it and going. So my hands started to turn really cold and blue. And then when you were pulling the blood, you noticed that my blood was darker than it should be. So why was it darker than it should be? What's the problem with that?
Well, my interpretation is that you were a bit stressed out over the procedure, right? Which is totally normal.
I was, and I just drove 3.5 hours to get here too. Yeah.
Yeah, so you're in a you're in a place that you're not familiar with, and you're getting this procedure, and so when we go into a stress state, our blood vessels narrow, and so that affects circulation, and then breathing patterns can become more shallow. So you weren't oxygenating very well. So darker blood is not oxygenated. Oxygenated blood is very almost pinkish. It can be very red.
Yeah, and then we met Michael Rice, who's here sitting here, the director behind the scenes, and he was helping me with some breath work. And then Michael had mentioned that using the Avicen, is that what it's called, Avicen machine, could help with my Raynaud. So explain that. I had my hand in there while you were taking the blood, and what was that doing to me?
Well, I'm sure Michael could just explain it much better, but it works on the sympathetic, parasympathetic nervous system. And so the act of the compression and done in a certain fashion of the Avicen, so your hand's in this machine with a glove on, and so there's an incredible amount of representation of the hand in the brain. And so giving stimulus to the hand can have very, very powerful effects on the autonomics, right? And so your autonomics are really at the area of your nervous system that are taking the stress when you were in it's the sympathetics, right? So you have your fight or flight, and you have your resting and digesting. You were in the fight or flight. So the Avicen switches people more into the resting and digesting, which is just a gift in today's world.
So you drew the blood, and then you spun it. Did you add platelet-rich plasma, or does the spinning create platelet-rich plasma? I'm not clear on that.
So platelets are naturally in the blood, and so it was rich in platelets because we created a blood that had. We took out a lot of the white blood cells, and we took out almost all of the red blood cells. I mean, it wasn't even red, right? So it's virtually all the red. And those. So it makes sense when you think about it like this. If you break a bone or if you get an injury, the body bleeds into that area, and that blood is liquid, right? But it turns solid, right? Once it touches, collagen is the activator, and the platelets basically are what activate, and then they release thrombin, and thrombin makes the blood turn hard and kind of like a hard gelatin. So this is your body's way of creating a graft, and so the body grafts its own tissue. So if you think about like a broken bone and you get a big hematoma, eventually part of that hematoma is going to turn into, it could turn into skin, it could turn into bone, it could turn into ligament, tendon, cartilage, So the body has this wisdom of knowing like what areas of that graft need to turn into what types of tissues. So we're in essence taking that wisdom that the body uses and putting it right where it needs to go. And so for you, it was your iliolumbar ligament, your right SI joint. There were attachments of your glute muscles and your piriformis along your sacrum, different sacral ligaments. There was a number of ligaments around your L4, L5 that we treated. Yeah,
and how did you determine where to treat? You did a ultrasound on my lower back, and then you discovered something as well that I wasn't aware of.
Yeah, and I think this is definitely worth talking about.
Yeah.
The fatty infiltration of the multifidi muscle. That's a mouthful, right?
I just call it fat back.
Yeah, you had fat back. Well, I think part of that is sitting for long periods, and then the other part is the fact that you were overweight when you were 24. And so one of the findings that I was seeing on MRIs for many, many years until I really had a tool to fix it was fatty infiltration of the multifidi. It would show up on the MRI because you can actually see it. You look at the MRI and it's like all this white tissue, which is representative of fat. So on the ultrasound, the white tissue, it's not white tissue, it looks dark, right? So it's called loss of the starry night pattern. So you see all these little fibers of the muscle on the ultrasound, but then you see all these voids, which are these dark kind of, void areas, and that's the fat. And I showed you that yesterday, and I had mentioned that I was shocked because, it was one of the more severe cases I've seen with that.
Especially on the right side versus, I had some on the left too, but the right side. So that helped you kind of determine where you wanted to inject the shots. So then I laid on the table. Michael was helping coach me with some of the breath work because I, tend to get into fight or flight mode, and I'm doing shallow breath. And then you started injecting my lower back. So talk about that procedure a little bit.
Yeah. So the injections are done, in and around the ligaments, and like I said, the PRP goes in as a liquid, and there's a little bit of an anesthetic in there. It goes in as a liquid, and very shortly after it turns into like a solid, gelatin in there. So it's grafting where the damage is, So we went through and we figured out exactly where you needed those shots, and then those were injected. And today it's the next day. It's extremely well tolerated.
Yeah,
right?
it's sore, but I could walk around, I could move. Yeah, the process was quick. It wasn't enjoyable, of course, but it was less than 10 minutes. And now, so getting in there, getting those shots, the PRP shots, that will help remove some of that fatty tissue in there. And then you also mentioned engaging these core muscles, not sitting as much, and then also for me, being more on the parasympathetic side versus the sympathetic side. So that'll be my protocol, right? To make sure I'm not sitting as much, to make sure I'm engaging those core muscles, to make sure I'm doing some more breath work, being focused, being conscious of my breath, which is a huge learning opportunity for those who are listening right now or watching on YouTube, because how many people have lower back pain?
Yeah.
It's so common, right?
I don't want to skip over this without clarifying. The core muscles in the back got all this fat because of its disuse, right? And it's something that happens with virtually all of us have some of that going on. I mean, back when we were plowing fields and we're a lot more active, some of these people, maybe construction workers and so forth, may not have that. But people like us that are on the computer and, we have office jobs, or, we're not as physical, it's going to be a natural occurrence. And so it's those muscles aren't getting activated enough. The fat starts to develop in there, and they just don't have the muscle fibers to be strong to support the spine. And so what they found in Spain, is that they found that cases of lower back pain that were failing all conservative care, that they saw all of this fatty infiltration, and they injected it with a different part of the PRP. So we didn't just inject that with PRP because that preparation was completely different. It was from your blood, but it was a completely different preparation that was injected in and around those muscles. And that will actually get those muscles to repair really nicely, especially if you start doing some activation with some plank exercises that we'll show you a little bit later. Yeah,
I'm going to be consistent with that. That was terrific. Thank you for that, explaining that. I think it's going to really create an awareness for those who are listening who have lower back pain, and maybe they've done some chiropractic adjustments, which is great. I felt a lot better. I'm still going to my chiropractor in Miami, but it wasn't, you want to go and tackle the cause, right? There is a symptom and there's a cause, and what we're talking about here is more of the cause.
Well, we do chiropractic, in my clinic as well, and I think the combination of both of those together is really going to be the premier approach for someone that really wants to stay functional. One of the things I was excited about was what this is going to do for you in 10 years, 20 years, because if we hadn't found that, you would have never known, and that instability would have never been able to be resolved like it will be.
Yeah, it was terrible. I was on the couch for 5 days a couple weeks ago. From just picking up boxes from my apartment lobby and then going upstairs. I put the boxes down and my back just went out. And for 5 days, I couldn't even walk my dog, couldn't even move. So that it was so unstable. I also wanted to mention you had a thought process there. Chiropractic. Oh yeah, the question is this: I'm supposed to get a chiropractic adjustment in 2 days. Should I still go to that appointment? Should I delay it another week? What are you thinking?
Yeah, I get asked that quite a bit, and my best suggestion would be to not for a couple of weeks at least.
A couple of weeks.
So, if it was me and I had you coming in and I'm conscious of where I was injecting, I would be more confident to say yes. But you know, we don't want to adjust any of those spots that were injected for a bit.
Okay.